so excited to welcome you to our 10th episode of Culture Shock Therapy, your health equity prescription. With your support and the Farm So Hard Network, we've made it past our 10th episode hump. Now, if you've made it this far, you probably know a little bit about me, but just in case, allow me to introduce myself. I'm Dr. Katrina Gipson, board certified emergency medicine physician and health equity thought leader. Culture Shock Therapy is a space for us to discuss how the social drivers of health, policy, and pop culture influence how you receive healthcare and healthcare information. Of greatest importance, I share with you your prescription for power. Now, these are small tasks and pearls of wisdom that you must rely on to not only improve your own healthcare experiences and outcomes, but to shape and inform a healthcare system that is not always equipped to care for its most vulnerable patients. You have got to work the system that doesn't work for you in order to get the healthcare that you need and deserve. Now, let me tell you something. I have worked in one of the busiest emergency departments in the country, serving the uninsured and the uninsured. These are disproportionately impoverished Black and brown and immigrant patients who, even when you do correct for education and socioeconomic status, still have worse and inequitable healthcare outcomes relative to their white counterparts. Now, while you cannot change the intersectionality of your identities, your race, your gender, your religion in the ED encounter or your doctor's appointment, you can and must change certain behaviors in the moment that will change your experience and improve your healthcare outcomes and collectively improve the healthcare system that allows these healthcare inequities to persist. Now, some of you might be thinking, listen, I'm not Black, I'm not brown, or an immigrant. What does this have to do with me? And if that's the case, your privilege is showing. When healthcare outcomes of the most vulnerable patients improve, the healthcare for all of us improves. Now, listen, I'll never forget this day. I was on a busy shift, not like any other busy shift, but there's this older Black woman. She'd presented to the emergency department with chest pain. This wasn't her first time presenting with chest pain, but she was in the hallway. I remember the resident physician who was taking her HPI or her history of present illness. She kept kind of interrupting her, kind of trying to hurry her along in her story. Also, her nurse that day was slow to address some of her concerns about her changing symptoms. Now, sure, remember, we're all busy. It's a busy hospital, right? But about an hour into her workup, this patient's pastor shows up, okay? He reiterated his concerns about how this chest pain was a little bit different than when this patient had presented for chest pain in the past, right? So his persistence led to a faster repeat EKG. We put the stickers on her chest so we can learn information about the rate and rhythm of her heart. We were able to get her moved into a room from the hallway quicker. And we called the cardiology again and got them to call back quicker so that she could get taken for a cath. This is a procedure where they investigate the vessels of her heart to see if there are any plaques or blockages that were causing the chest pain that may not have been there before. Now, what's important to realize is the moment that a friend, or in this case her pastor, showed up, she was able to work the system that previously had not been working for her. So today's prescription for power is to bring a friend. Bring a friend to the emergency department or to your next doctor's appointment even. So picture it. You're at home having chest pain. You're not sure if it's your normal acid reflux. Maybe you had some spicy food last night. Or maybe you're having a heart attack. Or maybe this particular migraine, I don't know, this is a little bit different. Maybe it's an aneurysm or a life-threatening bleed. Regardless of why you find yourself in the car or even in the back of an ambulance heading to the emergency department, listen, you're probably not having the best day of your life, and nor are you thinking clearly. And that is why it is important to bring a friend with you to the emergency department or your next doctor's appointment. Now, this could be anyone who's able to advocate for you and clearly express your needs and concerns should you find yourself in a vulnerable situation needing urgent or emergent health care. Now, this friend or family member, listen, they should be somebody who's familiar with your medical problems, your medications, your allergies, your exposures. Maybe it's your power of attorney who makes important medical care decisions for you when you're unable to do so. Maybe they know your DNR, DNI status. This means whether or not you want to be resuscitated, if your heart should stop in the hospital, or if you need a breathing tube for a procedure or some sort of emergent operation. This person should be able to contact your job or your family members if your situation deteriorates and you find yourself in the hospital for the long haul. Now, we like facts, figures, and research around here. So research does support the idea of getting improved healthcare outcomes when you bring a friend. For instance, the Journal of American Public Health supports the idea that bringing a friend to the emergency department or to your next doctor's visit leads to better understanding. Approximately 70% of patients report a better understanding of physician instructions, and they feel more motivated to follow them when a friend is present. Your friend leads to better accountability. Now, what about bringing a friend for more effective advocacy? Think about it. This is someone who can take notes. They can ask crucial questions that you may otherwise forget because you're sick, you're in pain, you're tired, or maybe you're just scared. They can remember pieces of your medical history. Now, bringing a friend can lead to enhanced comfort. Think about it. You've got a lot of anxiety, you're in an unfamiliar place, you're in a crowded, overwhelming emergency department. Maybe you're in a hospital bed that's in the hallway in a gown. Your friend is there to keep you comfortable, to keep you grounded. They can keep you abreast of your emergency department or hospital course. Now, for instance, we saw the impact of friends and family in the hospital during the COVID pandemic due to the inability of their being able to be there due to the concern for spread of infectious disease, right? So this pandemic further showed us that when a friend or family member is at the bedside, this can lead to reduced medical errors. Maybe your friend is there updating changes in your medications, allergies in the chart, or that friend might be able to relay nuances about sickness details or timelines that you otherwise can't focus on because you're distracted by what brought you there in the first place. And finally, bringing a friend to the emergency department can lead to fewer hospital readmissions. Think about it. Your friend's there, they're able to help you better communicate your needs, your symptoms, your past medical history. They're helping you follow the physician's instructions. That leads to improved adherence. And remember that fewer readmissions to the hospital leads to reduced healthcare costs, but of greater importance, it leaves you more time to spend with your family, friends, and doing the things that you love. Now listen, nobody thinks that they're going to end up in the emergency department with a possible life or limb threatening emergency. But if you do, identify a friend or a family beforehand who can advocate on your behalf. Now, not only will it improve your ED or doctor's appointment experience, leading to better healthcare outcomes for yourself, but it will shape and inform a healthcare system that isn't always equipped to take care of its most vulnerable patients. Your prescription for power is to bring a friend with you to the hospital. Bringing a friend will help you work the system that doesn't always work for you. Now, if you want to continue to learn about ways to improve your healthcare outcomes, inform yourself about policies, politics, and pop culture phenomena that inform healthcare and improve healthcare outcomes for society's most vulnerable populations, join us next time on Culture Shock Therapy, your health equity prescription. We're on all major podcast platforms and YouTube. Follow us on Apple Podcasts, rate us 5 stars, and share with your networks. Until next time.
Hola.